Hello and welcome back to Body Wisdom's YouTube channel out of Des Moines, Iowa. In this mini lesson, let's talk about positional release technique. PRT is a non-force technique that unloads the stressed tissues by bringing the muscles' attachment points closer together and holding this position for 60 to 90 seconds. This interrupts the muscles' guarding and spasm cycle, allowing the muscles to return to their natural resting state. Essentially, we're telling the muscle, it's okay to let go now. Now let's go to the table for a quick mini lesson on positional release technique. Before I start today with the demo, I'd like to mention that I have written a description of positional release technique and the neurological basis for that, and I'll put that link in the description if you want to take a look at that. So getting back to our demo today, I thought we would use the upper trapezius as a demo. And as we know from my intro, what we want to do is bring the two attachment points of the upper trapezius closer together. In this case is the occipital protuberance, and it's also the spine of the scapula. So in order to approximate those two attachment points properly, what you want to do first of all is take the person's arm and the hand, just sort of lay it on their belly, and then scoop up underneath the occiput so you really have a nice secure hold there so the person can let go. Excuse me, if they don't feel secure, they're not going to let go of their neck, and that's very, very important. Next item is to bring the spine of the scapula superior by bringing up on the elbow point. And then what we're going to do is rotate the neck to the opposite side, away from the involved side, because the trigger point's over here. And then we want to extend the neck. And then the third action is to side bend the neck to the same side. So going back to our elbow and bringing the spine of the scapula a little bit more superior, now we can play with these two attachment points and bringing them closer together and kind of fine-tune it, because there's going to be one position. It could be a little bit more extension of the neck, could be some more side bending, possibly a little bit more rotation. So you kind of play with these things until you get kind of a feeling of softening in the tissue, and then that would be your position of release. Now ideally you would hold this for at least 60 seconds, possibly 90 seconds, but for this demo we're not going to do that to take up the extra time. We're going to pretend that that happened, and then we're going to unwind this. So very slowly bring the neck back into neutral, bring the arm back down to where it was, and then we're going to recheck that trigger point and see if there's any softening. The wonderful thing about positional release, it only takes 60 to 90 seconds. If there was softening and opening and releasing, wonderful. Then you can work on what's left. If there wasn't, doesn't matter. You've only wasted 60 seconds and you can go on to other work. We hope you enjoyed this quick demo of positional release technique. It's the most magical bodywork technique I know, and it only takes 60 to 90 seconds per application. Once the muscle lets go, you can work on what's left with other techniques such as myo and deep tissue. If you're ready to dive deeper, Body Wisdom offers a comprehensive 48-hour positional release technique course this January 3 through 11. We highly recommend it for anyone looking to expand their skills. We'd love to see you there.